please welcome the CEO of Keep America Beautiful, Helen Lowman.
Good morning. How are you guys doing? It's been great so far, right? Well, at Keep America Beautiful, we are the 65-year-old organization that works across the country to end littering, improve recycling, and beautify communities and public spaces. So we've already heard some great things from Dan Buettner and from Gil Penalosa, really about the big picture. And when I started thinking about the big picture and the ripple effect that Keep America Beautiful's work has on the state of our society, I realized that litter is actually the smallest and the largest problem we have at the same time. So you may be asking, what does that have to do with healthcare? And actually, Keep America Beautiful's work is surprisingly strongly tied to healthcare. So I'm sure you've all been hearing about plastic straws and how they're littering our marine environment. And you may be surprised to learn that this modern everyday convenience actually entered the market through the healthcare industry as a health product. You may remember, and I'm sure you all use them, the bendy straw. So the inventor of the bendy straw actually got his big break from hospitals. And so at Keep America Beautiful, we recognize that plastic is actually an important material for our society, and specifically in healthcare. So Keep America Beautiful works to educate and support what's called a circular economy for plastics. Unfortunately, plastics have really been vilified because of improper disposal. But plastics are essential to the advancements we've seen in healthcare in the past few decades. I don't need to tell you, sanitary disposal items, tubes, stents, syringes, and artificial organs, and so much more all rely on plastics. So we work with plastic companies and industry organizations to help them with their overall image and market awareness. Plastics are actually a good thing. Improper disposal isn't. On a higher level, at Keep America Beautiful, we're all aware of the research tying mental health to physical well-being. There are dozens of published studies tying mental health to clean, green, and beautiful spaces. Gil Penalosa just spoke about clean, green, and beautiful public spaces not only improving mental health, they also reduce crime. And reduced crime equals reduced trauma. Keep America Beautiful believes that litter is both the smallest and the largest problem at the same time. To truly enhance the living conditions of a neighborhood, the neighborhood must be clean, green, and safe. And as you all know from Dan Buettner, additional research indicates that strong bonds with family, friends, and neighbors are also critical to the health and well-being of all citizens. At Keep America Beautiful, we know that our 650 local and state affiliate organizations and 5 million volunteers across the country build strong networks of friends and neighbors who all demonstrate a commitment to a cohesive and healthy community. This year, Keep America Beautiful is celebrating our 65th anniversary. Throughout our history, we have been able to measure the results of our work. Hundreds of millions of pounds of litter and recycling are picked up every single year. Tens of thousands of roads, parks, and shorelines are cleared of debris. Hundreds of millions of people are reached out to with our public service announcements to educate them about reducing litter and increasing recycling. These benefits can be measured in what we give back to the community. Last year alone, $230 million were provided back to the community through Keep America Beautiful's work. But actually, that's not really what we do. Keep America Beautiful and our affiliates clean public spaces and improve waste management because it makes those communities healthier places. And it is my goal heading into the next 65 years that we will measure our impact through the value of our work in human terms, not in the weight of litter or waste. But in other words, not what we do, but why we actually do it. Because we don't just keep America beautiful. We keep America beautiful so Americans can do beautiful things. And that is the perfect segue to our next speaker. So I had a wonderful opportunity to chat with Nancy Green backstage, and you're going to love hearing what she has to say. Nancy is the global practice lead of healthcare, insurance, and life sciences at Verizon Enterprise Solutions. And she is responsible for Verizon's industry strategy, marketing, and solutions for the healthcare and insurance sectors. And backstage, Nancy told me she's going to talk about innovation at the edge, as well as innovation on the inside. And she's going to provide for you some examples about what Verizon is actually doing to help the healthcare industry. She's amazing. She has 26 years of working in the health industry. She's served on numerous boards, and I want you to please help me welcome Nancy Green.
Thank you. So I should probably first answer the question in your head, why is Verizon speaking at a healthcare conference? I get it a lot. And it's because of what we do across the industry. And in the role that I'm in, I get the opportunity to really spend some quality time with customers across the entire ecosystem. And because our strategy in the space is one of enablement, we help innovate. So I'm going to actually spend some time around innovation on what we're doing and how we're doing it. The edge and the inside is something that we look at really, really well, or we try to with our clients. So I always like to open this with a quote. And if you search the internet around innovation quotes, you get a lot of them. And they're focused a lot around entering a market or taking a market by storm. But one that sticks out for me is one that Henry Ford actually does. And it's, you know, if I had asked what people wanted, they would have said faster horses. And it keeps resonating with me because it takes vision to innovate, right? It takes looking forward a little bit. And it's interesting as you look at these, most of the quotes agree that it takes strategy. It's going to take execution. It's going to take the right people in the right environment. But innovation isn't always a thing. And we get that a lot as Verizon, of course, because there's a lot of things at the edge that you see from us. But when you look at what Clay Christensen says, it's really looking at not just a product or a service, but a business model as well. And some of them can be disruptive. If you look at the Apple disruption that they did to the music industry, it was first customer experience. How do we change the customer experience? And then follow with the technology. So those things are important. But let's first look at the 4 myths of innovation. And these they could probably resonate with quite a few of you. But these myths that kind of shape the market around innovation, that innovation is not inherently just a good idea, right? They are, but not real innovation comes from getting it from that whiteboard out into the marketplace, right? And contrary to what people think, and we spend a lot of time with this with our clients, it's not always a good idea. In some cases, if you're an established company, innovation is more around a differentiation. And you'll hear me use those two terms today. Differentiation on an existing service or a solution or feature or attribute that helps and drives customers or patients or clinicians to create their own experience in your product and service. And in some cases, innovation can cost and not bring true value to that cost, and that's what we want to avoid. But a lot of innovation around things has that wow factor, right? And not all of it has to be complete or disruptive, but as we start to look on the innovation on the inside and innovation as we look at our customers, and this one stat kind of scares me all the time, is that 60% of the top 304 Fortune 1000 executives focus on product more than enterprise innovation. And if you think about that, those particular pieces then start to see a great amount of fertile ground for innovation. If you take the focus off of a product and look at how do we deliver that particular piece. And I get asked quite a bit when we look at innovation that you can see, how does Verizon do that? And I'm going to share a couple stories, and I'm going to share a video, because I think it makes sense because of the innovation that you can see, and we'll talk about how that drives and what we've done and what we've worked with our clients to do. So I'm going to set up a video, and let's hope this works.
A heartbeat can keep a patient connected to a clinical trial, or loved ones connected across the globe. A GPS location can serve up an offer at just the right time, or give travelers the information they need in real time. A temperature alert can help a farmer save his crop, or a manufacturer prevent a production failure and days of downtime. This is the digital transformation of business, right here, right now, right in front of our eyes. It's redefining entire industries and revolutionizing the customer experience. In the digital world, the network makes it all possible. Because without the network, a heartbeat is just a heartbeat, not powerful data that helps shape the future of disease prevention. A potential sale becomes a missed opportunity, and a customer waits instead of receiving a shipment that's critical for his customers. It's time to stop thinking about the network as simply technology, but instead as the heart of your connected business, the foundation for digital transformation and better business performance. Innovations like software-defined networking have made processes even faster, more effective, and autonomous, so you get the most out of all the technologies your business relies on, from the cloud to mobile services to the Internet of Things. Tomorrow's winners are being decided today. To be one of them, you need the right partner, one that not only delivers solutions you need now, but can help you think ahead and realize your vision for the future. Rethink your network. Transform your business with leading solutions from Verizon.
Okay, a little bit of a commercial, sorry, but that particular video for me showcases both the end device and the innovation on the inside. So if we look at where we innovate or the areas that we innovate in, there are 4 of them. That's where we go. Here we go. So we accelerate innovation in 4 areas. So the discovery model, right? So how do we help customers? And as I said, we spend a lot of time with clients, whether they're innovating themselves, looking at an idea, how do I take it to market? And helping build, right? So with the different assets that anyone has, but that Verizon has, we can help build across the globe, not just in the United States. Is it the right thing? We have quite a lot of customers who just taking their service solution or device mobile is a huge disruption to their business, but actually brings such new revenue streams to them because they're actually solving a problem. So creating those different builds. We do quite a bit of investment in the industry as well, and a good portion of our business is partnering, where we're maybe the inside and the partner is what's showcasing or on the outside, right? So we do that in a couple different ways. We source through our venture organization, our open innovation program, where we work with the academic and organizations that are putting through accelerators. And then the third area is co-working, or what we call innovation around device and network. And right now we're focused a lot around 5G, as you can imagine, and I will talk about 5G in a little bit. So as we source innovation, we create and work around digital building blocks. So it's not innovation for the source or the sake of innovation. It's sourcing around network. It's sourcing around IoT, huge IoT business, as you can tell, out in the marketplace now. But all of that needs to be secured. How do we secure information and transport as it rests, and how do we know who's sending it? Media and content, some of our interesting pieces and parts that we've brought to the table is the acquisitions that we've done of Yahoo and AOL and the media content that they bring. And then this digital ecosystem. And as you look at digital convergence, which I'll talk about in a few minutes, it really takes a partnership across many avenues to create that true digital convergence for clients. And again, that's on the inside. When you look at innovations that you can see, these are some of the innovations that we talk about and have done. All of these are things that Verizon has innovated with our clients. Some of these are large payers that have wanted to put care out into the community. They've wanted to do telemedicine or virtual care, even to the point of creating digital kiosks or digitizing or putting connectivity into one of the sleep apnea machines to notice and be able to help customers. There isn't anything that we can't sense, so it's been able to help us in healthy aging and longevity, staying in the home, different things. So these are innovations that you can see, right? As we talk about these, though, they're not very effective or have the wow factor without the inside or the network that it takes. And if you're not delivering or innovating around business outcomes, we found that they fall flat. And these are the areas that we have a tendency to work around, or business outcomes, which are empowering employees. And in the healthcare space, I hear more and more. I get to spend most of my time with C-levels across the industry, and keeping their clinicians engaged, keeping their patients and customers now engaged is a factor that they want to create some innovation around. Operational efficiencies are always there, and as we start to work towards enhancing customer experience. And I've been, again, in healthcare a long time. If you use customer in relation to a patient, it was kind of insulting. And that has now changed. That customer experience or patient experience is now starting to meld. But what we've started to work more towards is creating new business models. How do we help what you're doing to create a new business model? And they come from different ways. They come from different sources. But if we look on innovating on the inside now, I want to make sure that we talk about what's innovating and creation driven on the inside. So these are the inside, which is the network level or system level or platform level. In the last probably 2 years, we have spent more on innovation at the platform level with our own platforms and our customers than anything. And I know that seems kind of counterintuitive, but the platforms that drive that innovation at the edge, or the wow factor, is something that our customers are necessarily and needing to have as part of their plan. So let me take a business case for this. So if you look at, and unfortunately this happens quite a bit in healthcare, is this never down use case. And we have hospital systems that are hub and spoke, and they're big and they're large, and they keep buying and they keep buying. And unfortunately, there's still quite a few that absolutely understand or don't understand that I've got this network out there, but I don't have any network connectivity if something fails. So if your connectivity fails, your business is completely down, right? You don't have phone service, you don't have access to your EHR, you're now doing paper. In some cases, you can't even do that. So a simple innovation in network by creating connectivity that's a backup connectivity solves this issue, because the business time, although it's nice to say, it's a huge cost when you have a network time. Again, this is innovation at the network. Not very sexy, I know, but it is a cost. And some of the work that's been done, anywhere from $8,000 to $11,000 a minute of downtime is the cost. So those are, again, innovations on the inside as we look at. So I did want to, I can't come up here and not talk about 5G. So as we start talking about innovation, we talk about the innovation that we've extended into the industry around the 5G world, right? And it's coming fast. If you've seen some announcements, we've announced already some work to the home. But for us, it means in healthcare, it means getting to that edge, getting to that last mile to the home, and being able to do that quickly. For the IT and network folks, that means getting their connections in line faster, becoming more agile. So it also creates, because of its what we call low latency, which means things can happen faster, and you've seen some things we've even already tested remote surgeries. Some of the surgeons love it, patients not so much yet. Haven't done that one yet. So these are some of the use cases that we've seen. These are completely different. Some are external things that you can see, some are not. There's a lot of work going on in drones for healthcare, believe it or not, using this type of technology for payload delivery of resources. But as we look towards innovating around disruption, there's disruptors that we have in the industry every day. And it's really changing the landscape. And the first column is so crowded because it really absolutely is changing on a daily basis. Some of you probably see your logos in here. So that changes the way things are doing as we're innovating, but it's also that same customer is now looking to compete in that care anywhere, anytime. How do I take my care and move it to a different environment completely, and how can I do that without completely disrupting my business models? But that's a shift, as well as the payment models. But the consumerism side of everyday life is really drastically changing how people and how we work with innovators. So as a patient, as a consumer, and so sometimes marketing folks call it consumerism. If you talk to executives, they call it patient as a consumer or patient as a buyer. We as humans and consumers actually spend the most money on healthcare costs, more than CMS, more than any private pay insurance. So this tech-enabled person has now come in, they're more information aware, they're choice-oriented, and it makes a huge difference, and it creates the need for us as organizations and for us as Verizon, because we've had to do this ourselves, is to create a 360-degree view, and that requires a lot of lift from the inside. I have to create and make sure that my team members, their experience, whether they're clinicians or patients, the providers, the consumers, all of that has to come together to create that experience. And it's a global problem. It's not just a US problem. And these organizational structures that we've kind of grown up with have to adjust quickly, because there's such a tremendous need for personalization. Right? Everyone wants it to be the way that they are used to happening. It has to be affordable, and the predictability has to be in there. So as we look towards what's the relationship with this, and I always like to do this because we should really define digital. So I want to do that for you because it's actually really important. So when you look at discussing what digital is, it's really the intersection between network, tech, and information. Right, so that's how we talk about digital. And so that, from the user perspective, all three come together seamlessly when you talk about digital convergence, right? So when you look at how do I transform, how do I disrupt? So connectivity is pointless in all of this without the data being intuitive. So I have lots of data, I can receive lots of information, but if it doesn't make sense and it isn't going to the right person at the right time to make the right decision, it's really counterintuitive, right? So as we look towards some of the different pieces that we've got, the movement or the compilation of these two last areas as we look at this is this organizational strategy and digital strategies are combining. And when we talk through those are, and this is Clay Christensen again, but do we disrupt or sustain? And I am in conversations a lot with clients who have to sustain some things and want to disrupt another. And he's named a couple sustaining or disruptive pieces. And you think, if you're in telemedicine, you think that's not very disruptive, it's been around a while, but it does create a disruption in their business models. And as you look at some examples of innovation, they're covering different areas, right? Sustaining, partnering, Disruptive is really looking at retail expansion, which is a big change. Spent quite a lot of bit of time with some large retailers that are, actually they think of themselves as healthcare, they're not retailers, and how they're creating a complete clinic environment in their retail stores to solve the problem of access. And they're having to create partnerships with providers in the market because they need the provider networks to create that clinical innovation and synergy with the marketplace. When you look at questions, though, and there's a lot of them in here, we spend some time really on the discipline of it, what's the result of it, and are you or do you have a willingness to fail in it? And in some cases, it's around failing fast. So we try and work towards how do we fail fast in this. So I don't know how many of you, and I can't really see you guys, so I can't say raise of hands, but as you look towards future-proofing and going digital, you've heard the thing, go digital. They say it's fun. It's not. It's not fun because it really can create some chaos. You have to focus on what's being delivered, and it's really about digital convergence, not replacing an analog problem with a digital Band-Aid. And unfortunately, we see that a lot because it will not solve the problem. And as you start to look at the endless possibilities of creating this innovation on the inside to create this really wonderful thing on the outside, mobile's figured out, right? We figured out mobile. So it's not that it works, it's what's the data that's coming, where is it going to, and really looking at what is being asked and answered for that device. And it can also be, we've done a lot of things around this space. So do you have a problem with guest parking? Do you have a problem with security? Or you have a problem with signage? People aren't really interested in talking to a billing coordinator. Can I do something where I can do it on my phone? Those are all things that at the edge look very interesting and wow factor-ish, but the network and the connectivity on the inside really takes a toll on what we're talking about. So what's it mean to be future ready? These are great things that we can focus on. So on the unexpected, have to be ready for those, right? Engagement. Again, I spent quite a bit of my time around engaging our clients, on engaging their customers and their clinicians. Are you getting new customers? Are you moving the needle in the customer space? Within healthcare, we didn't used to have competition. We didn't have to used to worry about brand necessarily, especially in the provider space. Now you do. So what does that mean as we really start to compete in that space? And how can we be agile in speed, as well as all the data that's coming at you? How can you best work towards that, right? And so I like to end, I'm into quotes if you haven't figured that out. So I want to end on a quote of working with change. So change is important, but differentiation is probably even better. Something that we're working with every day is change around. So without change, there's no innovation, creativity, or incentive for improvement. Those who initiate change will have a better opportunity to manage the change that is inevitable. And I'll end on that because the change is inevitable. Try and say that. But how you go about it makes a huge difference. And would love to partner with you, but I think as you start to look at innovation within your own organization, I would just caution you to look at both what's inside and what's outside. Thank you.